All right. Well, today is a special day. We have a Facebook Live. It's whatever day it is. It's Sunday morning.
9 a.m.
9 a.m. Sunday morning. I'm actually in Lauren's house right now. Dr. Michael Gorman.
I'm Dr. Lauren Bennett.
And we're doing a Facebook Live today about dry needling. So this will be a podcast this Wednesday.
This Wednesday, yep. Following up our previous, 3 episodes?
Two or three episodes about dry needling and chronic pain. And we thought it'd be really cool today to do dry needling on Lauren. So we're going to talk through all that. But we got to give props right now to our cameraman. This is Lauren. You can't even see him, but this is Lauren's husband, Austin.
Hi, Mom.
There he is. You can see him, and he got up super early today to help us. So kudos to Austin. Thank you very much. And are we paying for this? You got.
Nah, he's fine. Payment food.
Payment food. Okay. So we're gonna dry needle two muscles on Lauren. One is called her upper trapezius, which is right here. Which, if you have pain, if you have a trigger point there, it can refer pain into the side of your head. It can give you headaches. Of course, pain in that area as well. But it's a huge one for when people have headaches. And we're also gonna needle her inside of her calf muscle. Do you care which side we do it on? Okay.
No.
So she doesn't really have any issues with the calf or leg, but she does have issues on the right side. What kind of symptom do you is this tight? What do you have?
Well, if you follow me, you know I play a lot of pickleball. So a lot of overhead stuff, softball players. So it's just like feeling of knots, I would say, that gunky knots, tightness and crunching when I move my shoulder around.
Okay. All right. So we're going to work on that. So before we dry needle anyone, we always do what's called informed consent. We have a piece of paper that we go over with you. A couple things. We will use a sterile thin needle to penetrate your skin to get to the trigger point itself. Okay, we'll get to the trigger point. What we're trying to do is deactivate that trigger point. When we do it, you may have pain in that area. You may have symptoms that kind of spread. You may get actually a twitch, which is what we're actually going for, because we will know we're in that trigger point itself. So you may get any of those symptoms. Just communicate with me what you're feeling. Do you feel it here? Do you feel it spreading? What's going on? And then the other thing is you're always in charge. So if it gets to be too much, if you're like, no, Mike, this isn't cool, just tell me, and we'll either stop or we'll just take it out. We'll probably spend anywhere between like 30 to 45 seconds in each trigger point. Within a muscle, you may have several trigger points, maybe 2 or 3. It just depends. We'll see what you got. There's risks, of course, but the risks are very minimal. But first of all, I need to ask you, are you on blood thinners?
No.
Are you pregnant?
No.
Okay. And do you have any implants?
No.
Okay. So those are questions that we always ask. We just want to make sure of those. We can, if you are on blood thinners, we can needle you. There's just 2 muscles in the body we can never needle if you were on a blood thinner. Okay. So risks, of course, there's always a risk of infection, but we use sterile needles. It's 2023, so we don't share needles. And most times I use a new needle for sure for every muscle. If we hit if there's a couple trigger points, depending upon how tight those trigger points are, I may just use 1 needle per actual trigger point. But for sure, when we switch from muscle to muscle, we'll use a new needle. So there's always a risk of infection, but there's a chance of what's called a pneumothorax, which is where we accidentally hit your lung, which if you're with a trained person like me, that should never ever happen. We are going to needle your upper trapezius, which is up here. So we have to be careful because oddly enough, and people think, but the lungs extend pretty far up. So we'll be very, very careful in that area. But yeah, and you could get some bruising. Okay. That's wouldn't be shocking if you did. And then the last thing is, today, people always ask, well, what do I feel afterwards? Honestly, you'll probably feel like you had a workout in that area. You might be sore today, maybe into tomorrow. Shouldn't be past that, but you may just feel kind of fatigued in that area. So we encourage people to move. We encourage you to be active. And that you should be fine. So.
Okay.
All right. So again, we didn't have her sign it because but we should have her sign the informed consent. So before we ever needle you, and not just with IMU PT, but wherever you go to get needled, please make sure that you're signing an informed consent that the therapist goes over with you everything about dry needling. So enough of me talking. Do you have any questions?
I don't think so.
Okay.
I mean, do you like palpate so you know exactly where the knot is? Because you'll find it.
Mm-hmm. So we're gonna find where your trigger points are. We always, before we needle an area, we clean the area with the alcohol prep pads, just to again keep it as clean as we can. And then again, if you feel like you need me to stop, just tell me.
Okay.
Okay. So we're gonna do your wrapper trap. So we're gonna have you on your left side.
Okay.
So let's come right here. Okay. Now I want your head and neck to be comfortable and relaxed. Is it there?
Yep.
Okay. I'm gonna put a pillow in between your knees.
Okay.
Okay. We want you to feel like a queen. All right. So a couple of things here. Let me get the right size needle. All right, me as a therapist, I always use gloves, of course. So I'm going to ask you, Austin, is anyone on this Facebook Live?
There was one a little bit ago, but right now we're just us.
Oh, just us?
We're just
people were 9 o'clock.
The Blues played last night late.
Oh, that's right. They played Anaheim.
The Ducks, I think. Yeah.
Did we win?
We won.
We won like
It's a big
6-3.
day. Big day for St. Louis. I think our MLS team won. We had a doubleheader for the Cardinals. We won both of those.
Did we?
We won both of those,
Is spring training over now? Probably today, maybe last game.
I think, as far as I know, it's still going on. But
Yeah, opening day is Thursday, I think, or something like that.
Yeah.
I did see that our MLS team won.
we won 5-0 now. Yeah.
We're 5-0, and that for sure is the best record of an expansion team.
It's crazy. Yeah, even 4-0. We're just
Battlehawks. Oh, Battlehawks won last night?
Yeah, I know. All around, just big day for St. Louis. It's crazy.
Not that I'll talk about what happened in the past, but I'm going to say, excuse my friends, but screw you, St. Louis Rams. LA Rams, whoever you are. This is a really good sports town. Okay. All right, so I'm going to come right here.
Let's see.
Yeah, you can just move Austin wherever you want.
Okay.
Yeah, you're good there. All right. Oh, that definitely feels like. Is that tender at all?
Yeah, a little bit.
A little bit. So what I'm doing here is just palpating and seeing where this trigger point is. If you don't know what a trigger point is, you haven't been tuning in the last 2 weeks, so shame on you. But a trigger point is a very tight area within a muscle that is very taut, very, very tight, has inflammatory chemicals in it. It's just, for lack of this isn't a scientific word, but what I say, it's a ball of gunk. And and as long as that trigger point is in there, yes, it's going to be painful. It can refer pain, but the muscle will not be able to function. Okay. All right. So I'm just going to clean your skin off. So we're going to come down here. We're going to clean upper trap off. All right. So I'm going to take the needle out of here. And Lauren, the needle's inside this tube, and the needle is from there down.
Gotcha.
We won't probably put all of that in you, but it'll probably come to about right here, I would imagine. Okay?
All right.
Okay, let me... So this needle's in just a little tube. I'm going to take this little twisty thing off. Okay. All right, so I'm going to come back. We're just going to find that trigger point in you. Okay. It's definitely right there. Yeah. Okay. So I'm just gonna pinch your skin up a little bit. Try one more time. All right. So what I'm doing, I'm pinching her skin up. I'm trying to lift the muscle up. You okay?
Yep.
All right. And so my needle is right here. And I have needle in, okay? So you guys can see that, right? Oh, Austin's right.
I'm
close.
I'm right there. Sorry.
So if I kill you, I'm just joking. If I kill you, I have lots of proof here. No. Joking, everyone. Okay, so needle's in. You doing okay?
Ooh, yeah.
You feel that?
I can feel it.
Okay.
Yeah, good. It's very minimal.
Very minimal. So
Yeah.
so you may feel it locally, which is just
Yeah.
kind of where that needle is. Yeah, we got a little twitch there. Yeah, you feel that little twitch?
Oh, yeah.
Sometimes you can, I feel it. I don't know if the camera can pick it up or not, but we're getting a nice twitch in this upper trapezius trigger point.
Yep. This twitches like every couple seconds.
Yeah, and we go until the twitch resolves itself because we want to, for lack of a better term, get it all out. We want to deactivate that trigger point. And sometimes what I'll do is I'll move this needle around a little bit. Oh, there we go.
Ooh, yeah.
You okay?
You're in the spot.
I'm in the spot, okay. Now sometimes when I do this, people will reproduce their headaches if they have it.
Oh.
Okay. Okay, needle is out. I'm going to apply a little pressure for just a couple seconds. All right. Okay, so describe to me what that felt like.
Just like a little poking, I would say, and then after probably 10 seconds, I felt twitches every 3 seconds. But it was pretty minor.
Pretty minor. Okay,
Yeah.
good. So if Lauren was a patient that was really painful, it would, and more kind of reactive, if you want to call it that, she would probably definitely be getting pain that would be spreading, bringing on her symptoms. And again, this is a big muscle that we trigger when people have headaches. Okay. All right. So I'm just going to come in through here. I'm probably not going to do a second one here, but you let me know if I come across anything that's sort of. Can you pull your shoulder up a little bit? There you go. Relax for me. Relax for me. Okay. So again, if Lauren were a patient that were coming to us, I guarantee she'd have a lot more going on. But that was definitely a good example. That was her upper trapezius. That was a trigger point in her upper trapezius. So I'm going to take this needle right here. I have a sharps container over here. I'm going to drop it right in my sharps container. Boom. Without getting needles all over the floor. All right. Drop it in the sharps container. Okay, so now we're going to move on. Let me clean up my stuff here real quick. Okay, Lauren, go ahead and we're going to get you on your stomach.
Okay.
Okay. Okay. All right. Now, do you want a pillow underneath your stomach?
I'm okay.
You okay?
Thank you.
So when people have most times when I have a patient lie on their stomach, I typically give them a pillow to put underneath their stomach because you can see what's happening even with her. Her spine is extending or arching. Just from lying on your stomach that happens, and she's also propped up on the pillow. So most times when I'm treating someone, I always put a pillow underneath, but she's okay.
This is good for me.
It's okay. So it's good for her.
Yeah.
So the main thing is if you're a patient and you're getting dry needling somewhere, be comfortable.
Yeah.
All right, I want you to scoot a little bit towards me. There you go. Okay. So this muscle is called our gastrocnemius right here. There's a smaller muscle called our soleus, which is underneath it. But this area inside of the gastrocnemius is typically an area that receives a lot of trigger points. So patient will, not only can they have pain here, it can spread a little, it can refer pain up and kind of into the back of the knee and up into the upper or the lower hamstring area. But it can also refer down, and it can give people pain in their foot, almost making them think they have plantar fasciitis. So trigger point is here. They may have pain here, but they may also have different areas. So, and really, if she has a real active trigger point right here, and I needle that, she's probably more than likely going to have the pain wherever her pain is. So if she has what she thinks is plantar fasciitis, by all means, people do have plantar fasciitis, I get this, but if it's causing this and I needle that, this should bring these symptoms up. Okay, so your calf overall is pretty good, right?
Yeah, I had like Achilles tendonitis years ago, but it's fine now.
Okay, all right. Which side do you have your Achilles tendonitis?
This one.
Left one, okay.
Yeah.
All right. So again, I'm just palpating around, just seeing what my, so a patient this past week told me something so cool that in my 30 years being a PT, no one's ever said. She goes, "It's like your fingers have eyes on them."
Yeah.
That's kind of neat. I've never heard that before.
They always say, you know directly where to go, don't you?
Yeah.
But that's one way of putting it.
Yeah.
Yeah, we have Marilyn Endicott, shout out. She's watching live here, so there we
nice.
go.
Thank you. Thanks for joining us.
Yeah, I would say that's pretty tender in there.
Yeah. So this is the inside of her gastrocnemius muscle. And so I'm going to just try to pinpoint a little bit closer where it is, where that trigger point is, right there.
Ooh.
Yeah, right there. Did that cause any symptoms?
No, just
But
tender
you
right
could
there.
feel it, huh?
Yeah.
All right. So, again, I'm going to clean her skin off. We want to be as clean as we potentially can be. All right, our needle. So on the gastrocnemius, we're going to go a little bit with a little bit of a longer needle. Okay, it's the next size up. There's many different sizes of needle depending upon the muscle that we're triggering, and sometimes, honestly, the size of the person.
Okay.
All right. So let me just see where I'm at here again. Right
Yeah,
there.
you got it.
So she has, we talked about trigger points. Lauren and I did on the podcast, and there's a latent trigger point and an active trigger point. This is the latent trigger point because it's not reproducing any symptoms, but it's there.
Yeah.
It's kind of that we talked about. It's like that volcano that's just kind of waiting to erupt. Okay, it's not erupting right now, but it's waiting to erupt. So, all right, so I'm going to come right here, and again, just locating exactly where I want to be. Then I'm going to just lift this muscle up. You doing okay?
Yep.
All right. And I'm going to angle this needle a little bit this way. People always ask, well, how do you know what nerves and da-da-da to avoid? Well, in some parts of the body we don't have to worry about, but right here, there's a nerve coming right down the middle. So when we needle the gastrocnemius, whether it's inside or outside, we kind of angle a little bit away from that middle.
Okay.
So I'm not going to go straight to your midline, I'm going to angle a little bit. All right. Needle's in. You okay?
I'm okay.
All right. So here we go. I'm going to come in. And we're going to see what we get. How you doing?
Woo. That one feels more like an intense shot.
Yeah.
But I'm still okay.
Are you feeling it locally, like where my hands are, or is it spreading?
More locally.
Locally, okay.
Yeah.
So
Just right at the side.
yeah, so we're not getting in. You can see that needle is not all the way in, but it's pretty far in. You can see I'm angling away from the midline or the center of her calf. Austin is a tremendous photographer. Videographer. I didn't mean to call you photographer.
Yeah.
I need to get the right terminology.
Better, yeah. You better watch out. Oh, it's
Kinda
looking,
like
it's
a
looking
bee
really
sting,
good.
I would
Kind of
say.
like a bee sting. Yep, she said it's kind of like a bee sting.
Oh, we got Angela Derrick on here. Oh boy.
Angela, what's up, Dr. Derrick? You can give us a thumbs up, Dr. Derrick, if you want. She is one of our great therapists over in Illinois. She has certified dry needle alert as well. How are we doing?
It's subsiding a little bit.
Yeah.
Still like a low grade bee sting, I would
Yeah.
say.
And it's myself as a therapist, what I feel is the muscle, that trigger point soften. I can feel it soften. I can feel my needle be able to penetrate a little bit more.
I don't feel any twitching this time though.
Yes. Some muscles we get a little bit more twitching than not. And I would say the more active the trigger point, the easier it is to get that twitch too.
Yeah.
You doing okay? So now I feel my needle pretty much nice and easily gliding in there. Needle is out. Put a little pressure here. All right.
Mm-hmm.
All right, so we're just going to see if there's any other areas that we need a needle, but I think that's probably going to be good for now. All right, let me put my needle in the sharps container. All right, so Lauren, you did great.
Thank you.
You did fantastic. I bet next time, you guys playing pickleball today?
Tomorrow.
Tomorrow?
Tomorrow's a big
I
day.
bet you win every match.
Oh, if it's that easy, sign me up for training.
Yeah.
Right, yeah.
For every
Yeah.
tournament.
We
A bit of idea of what dry needling is. It's, look, if you have a total phobia of needles and they make you anxious, I wouldn't do this, to be honest with you. It's very safe, and again, it's a dry needle. We're not injecting any fluid. It's not a cortisone injection. It's just a very, very, very thin needle. But if you have total anxiety to needles, this may not be the right treatment for you. But if you don't, it's a heck of a good treatment for clearing out of those trigger points.
Yeah.
Well, this was our first Facebook Live podcast. Check us out on YouTube. Go to iMovePT for our YouTube page. And thank you again to Austin. Turn the camera on
all
so
right.
people
Here we
can
go.
see you,
Here,
Austin.
I'll just kind of go in the little group shot here. There I am in the mirror here. I know we just hung that yesterday, so we had to make some use out of it here.
Yeah, my goodness gracious. Okay, well,
Oh, man.
thank you. Lauren, anything else you want to say? What's on the agenda for next week's podcast? Oh.
Well, next week you're doing your PA, right?
Yeah, so next week, next podcast, I'm so confused on my days, but this podcast, this Facebook Live is going to be Wednesday, this upcoming Wednesday, which is, I don't even know what the day is, March
29th or 30th
March
or
29th.
something like that.
Then the following week, we're going to do an interview with 2 physician assistants because I think a lot of people, when they hear they're going to see a physician's assistant instead of a physician, they may get a little bit, oh no, I don't want to see the assistant. Guys, they are incredible. They have incredible skill, incredible talent. And myself, when I've seen a physician assistant instead of a physician before, I got a little bit more, I don't know if the word is time and attention. I just felt like I was heard a little bit more. Nothing against physicians. But, normally a physician assistant will have a little bit more time. So anyway, we're going to do a great interview with Paige and Raquel from Blue Tail Medical. And if you have any other ideas for podcasts, Facebook Lives, reach out to us at
info, I-N-F-O, at iMovePhysicalTherapy.com.
All right. Until we see you next time, have a great day, everybody.
Thanks for joining us on a Sunday.
Bye-bye.
Perfect.